Hi, my name is JC.
And my name is Juan. Welcome to The Couch, a podcast where real therapists talk about real things.
Please remember that we are therapists, but we are not your therapists, and this podcast is intended for educational purposes only.
Today we are chatting about ADHD, Attention Deficit Hyperactivity Disorder.
Yes, ADHD, something that is near and dear to my heart and also my brain because it gets real personal around these parts when it comes to the ADHD.
And you and I, JC, we are ADHD warriors.
That we are. We are of the neurodiverse category, or if you're on TikTok and you see it all the time, neurospicy is another way that it's been
Is that
described. It's
neuro
not,
spicy?
yeah, it's not my personal favorite thing. However, I respect anybody who wants to identify their brain differences any sort of way. And, I'm just going to let them have it. I'm going to
Mm.
let them have that one. But, oh, continue.
No, no, no.
Continue.
I was gonna have you. I know neurodiversity it's a term that it seems like we're using it more and more in the last couple of years.
Mm-hmm.
So,
Yes.
so I think maybe if you can spend a little bit of time kind of breaking that down to help people have a strong understanding of it.
Sure. So when we talk about neurodiversity or being neurodivergent, we're just talking about having a brain that works or is formed differently. So that is dyslexia, that's autism, that's ADHD, dyspraxia, dyscalculia, bipolar disorder, OCD. There are so many things that cause our brains to work differently. And neurodivergent is just kind of the word that we use as a blanket for everything.
Okay, I like that. So one of the things that stuck out to me, and I know we're here focusing on ADHD in adults, is myself being an adult with ADHD. My brain works a little differently.
Mm-hmm.
All right, and anyone listening in, if you've had a diagnosis, maybe often takes place during childhood. Not to say that it can't take place during adulthood. Um,
Mm-hmm.
Knowing that you're in this category of neurodiversity, for me, that was helpful. It gave me an idea of it's not that something is wrong with me. It's
Mm-hmm.
that I see things and I operate uh, differently than maybe the norm, right?
Mm-hmm. Yeah,
Okay.
definitely. And it's important also to remember that neurodiversity and being neurodivergent, these are non-medical terms. So this isn't like you go to the doctor and you are given a diagnosis of being neurodivergent. It's a way to identify yourself and those around you that have similar experiences. So you might hear someone who is deaf say that they are deaf gain or that they are hard of hearing. So it's not hearing loss, but instead being deaf gained. Or you may hear something like able bodied, referring to somebody whose body is capable of their typical activities of daily living, or a mobility aid user, as opposed to somebody being wheelchair bound. It kind of is couched in that uh, people first language, the
Hmm.
label of being neurodivergent.
So I think for me, maybe you and I could spend a little bit of time here discussing each other's ADHD. I started
Mm-hmm.
noticing my symptoms show up, which could be funny. As a kid, I would
Mm-hmm.
I would take tests or I would be in class, and my attention, interesting enough, would be focused on everything else but what was in front of me. I was very bored by
Mm-hmm.
what was in front of me. I was interested in like the thing outside, or what's that noise, or what's that smell, or I wonder what this is going to be over.
Mm-hmm.
And then I would come home and I would get fixated on things. Maybe I would just spend a lot of time doing one activity. And those looking back, those were my signs of, hey, I'm operating a little bit differently than the others.
Oh, for sure. It's actually interesting because I didn't get my diagnosis of ADHD until I was an adult.
Hmm.
So I was in grad school when one of my professors pulled me aside and was like, "Hey, did you know that sometimes you write essays and don't finish the sentences?" And I was like, "What?" And she said, you wrote this like 17-page paper, and there are multiple spaces in which you just didn't finish the sentence. And I was like, oh,
Mm.
that's crazy. I don't know what happened. And then I'll think about me writing that essay, and I will remember that I got up to go get a snack. And then I'll remember that I got up to go talk to my roommate, and I ended up talking to her for like an hour and a half. Or I decided to take a drive to clear my mind, and I ended up at my parents' house, which is like 45 minutes away because I
Mm.
decided I wanted something from my parents' house. Like, it would be stuff like that. And so when I would go back to the essay, I'd be like, oh, I don't even remember what that sentence was. It's okay. I'll fix it later. And then I would keep typing, and I would never remember to go back and fix it later.
Ah.
I am uh, I'm one of those people who has really bad time blindness. So I try really hard not to be late, but there's no guarantee that I won't be. I'm a little bit disorganized and a wee bit messy. And I always thought that those were like just personality quirks. And then
Yeah.
I talked to like my doctor, and they were like, oh no, brother, let's do an assessment. And sure
Mm.
enough, at the ripe old age of 26, they were like, hey girl, you've got ADHD. I'm so sorry. Like,
Ah, man, what that's such a journey there. And it's I think I've met the different individuals. It's a commonality there that people will see it. Myself growing up, I was born out of the U.S. and with that came certain educational holes in my family system. So when I struggled, it was work harder or pay
mm,
attention. Um, a couple of other comments, if you will. And I knew something was off because I would study, and I remember this was pretty painful. I'd cry sometimes because it was so painful. I would
mm,
study so much and highlight everything and reread it and be in study groups. And in my study group, my peers, they would say, "Man, you're going to do really well." No, I would get the lowest grade at all of them.
mm,
And that was like that pain of that it was difficult for me to retain certain things, or I can translate it back to the other side. The different items like that. I had an idea that ADHD was there, but the
mm,
diagnosis didn't take place until actually pretty recently, as far as like a formal one. I did during undergrad try to pursue some of the testing, but I got a bit nervous with just with doing it. It was new. I had no
mm,
prior experience in like mental health, and there was a lot of cultural items there that really got in the way. But now knowing it, it explains a lot. I wish I would have had that early. Like I see some of the,
mm,
the younger individuals I work with. And when we talk about it at an early place in their life, maybe they're 7 or 8 years old, to the whole family, it's like a relief, like, okay, well, this makes sense. Now we're going to just shift the rules a little bit and reorganize life. And then before you know it, child's excelling and doing well versus thinking something is wrong with them.
Isn't it incredible what healthy accommodation can do
Mm.
to alleviate stress, not only for like the parents of these kids, but I know that, again, being an adult who got a diagnosis, it explained so much of my life in so many different ways because I'm on the flip side of that aspect. I've always been pretty inattentive, and I've always been pretty scatterbrained and late and messy, and I have terrible object permanence. So like I put things down and lose them all the time. And that's
Mm.
always the way that I've been. But one, because I am socialized as a woman, like as a girl growing up, my parents would be like, oh, just stop being careless. Like don't be reckless, don't be careless, and pay attention. But I always got good grades. So no one ever thought to assess me for
Mm.
ADHD because they were like, oh, no, she's just messy. Oh, she just loses things. Oh, she's just a little scatterbrained, but she makes straight
Yeah.
A's. So it doesn't matter. And honestly, just knowing that there wasn't something wrong with me was incredible. I was like, oh, thank God. It's not me. Like it is me, but like there's a reason. And I was
Mm.
very vindicated, and I did call my parents, and I was like, aha,
There you go.
look,
Yep.
look at what I figured out. Um, but I am much like the other an estimated 15.5 million adults in the United States have an ADHD diagnosis, and about
Hmm.
half of those people get that diagnosis in adulthood.
Yeah. And you put a good point there. I'm gonna uh, help me re remember the literature. Girls are underdiagnosed,
Mm-hmm.
and often what happens is, as you mentioned, society says, "Hey, shift your behavior,"
Mm-hmm.
and then that I think, and I see this in adults where I may be working with. It could be an executive female at maybe at a bank or something.
Mm-hmm.
And we start getting to know each other, and maybe I'll do an ADHD assessment. It comes back, and then I'll ask about these areas where the ADHD is highlighted. And then what they tell me is they'll tell me ways they've masked it or
Mm-hmm.
compensated. Why do all this extra stuff to make sure that's not taking place? And before you know it, from childhood to young adulthood, all the way to adulthood, you've done all of these extra things to like hide and mask those symptoms. And they're still there. They're just hidden by all this extra work.
Oh, absolutely. And masking is exhausting. Like,
Hmm.
one of the focal points of neurodivergency as an acceptance movement is understanding that there's nothing wrong with you the way that you are. You can live your life and experience the symptoms of your diagnosis, and it doesn't make you any lesser. And I think that's something a lot of people have a hard time understanding, especially when it comes to a diagnosis like ADHD, because when you say ADHD, we're thinking kids,
Yeah,
right? But ADHD children turn into ADHD adults because remember, it's a fundamental difference in the way the brain works. So oftentimes you don't grow out of ADHD, it just grows with you. So
correct.
understanding and knowing that about yourself gives you sort of an unlimited vision of the world. Like, oh, I know that I'm chronically late. So I know that I need to find an alarm clock solution that actually works for me. I
Yeah,
know that I'm going to need an alarm, not just for when I wake up, but I need an alarm to remind me to get off my phone and get up to go eat breakfast. And I need an alarm that tells me about what time I need to leave the house to be on time. Like, I know what I need.
yeah.
And it's all because you're not masking. You're actually giving yourself proper accommodation to handle what you need.
Knowing that, and there's this nice diagram. I can't remember where it's at, but it brings attention to the brain. And we have the prefrontal cortex, right? So it has a lot to do with our executive functioning.
Mm-hmm.
You stop me at any point if I'm wrong. I'm going
I
off
gotcha.
I'm going off my memory here. So with your prefrontal cortex, there's this cool hand model that sometimes I'll do with individuals. If you imagine you have your hand, well, you got one,
Mm-hmm.
and then you got your fingers, all of them except for the thumb. Your four, imagine those as your executive functioning fingers. So impulse control,
Mm-hmm.
organization, emotional regulation, work in memory. Right. So those right there, and then a lot of more items that go into that. Well, those, the executive functioning, we need that as adults, right? We need that to get to work on time.
Yes.
Right. We need that if you have a project that needs to be turned in next Tuesday, you need those executive functioning skills to help you start, complete, and submit the project. You need that to be organized to know that this Friday you got a date night with your partner, or that you need to lock the door before you leave the house. Right.
Mm-hmm.
All of these items goes into how we as adults can function effectively in life. ADHD, think about it as limiting those fingers, right? So they're just not as effective. I mean, it may not be all of them, and it may not be all in the same way, but they're impacted. So now you can really visualize how if you are a contractor and your job is to maybe repair a home, this could be really this could create dysfunction. I remember I worked with one individual in a different field where they had a structure and support in many areas, but then when it came with their management of finances, They would get all of their receipts or invoices, and then they would struggle to go back to their customers and turn them back in. So they had all of this money on the table because of that difficulty with executive functioning, right? That's one example. There's many more. Perhaps you can look at your own life and think about how are you doing with these domains of executive functioning?
Hmm. Absolutely. And it's so important that you actually bring that up because some people have the stigma of saying, like, oh, well, it's all in your head. Well, first of all, of course it is because that's where the brain is. But we
Mic drop.
have we have evidence that leads us from the purpose and function of this specific part of the brain, and we have a connection to why it is different. Neurodiversity celebrates the fact that your brain may be wired differently, but that's not a bad thing. And having that example that you just gave, Juan, I hope will give people a clearer vision of what is happening inside of the brain with ADHD.
Hmm.
So
As
I didn't have to stop you at all. You were right there. You
well, there
had
we
it.
go. I'll plug this in too. I like working with couples, and every so often I may work with one, and we bring up ADHD,
Mm-hmm.
which could be interesting if you're listening in. But again, ADHD has a lot to do with that prefrontal cortex. That's your executive functioning. Now,
Mm-hmm.
in there, emotional regulation. So
Ooh,
if
a
there
big
is
one.
exactly right. So if there's the ADHD, that could mean that you have a hard time with, let's say, taking feedback from your partner, or it could be that you have a heightened state of irritability. Just overall, there could be a struggle to regulate your emotions because of the ADHD being there. Knowing that, vital knowing that, because it could answer a lot of questions in your relationship of why is there a struggle with going deep into emotions or with problem solving or conflict resolution. And it could really tie well with having this understanding.
And if you're looking to do a little bit of your own research on it, the language that you can use is rejection sensitivity dysphoria, RSD. It is the severe emotional pain that comes with those feelings of failure or feelings of rejection, often felt by those with ADHD. And it's a huge stumbling block in relationships for folk that experience that type of neurodiversity because your partner is trying to offer you leveled feedback and it feels like one of the most painful things you've ever experienced, so you avoid those conversations, you avoid having those that commitment, you might avoid commitment altogether if it is
Hmm.
painful enough. So I actually think that maybe we should dig into how ADHD affects relationships at some point,
Yeah, that'd be
because I
good.
feel like that could be really helpful for people who maybe one partner is neurotypical and the other partner is neurodivergent. So
Yeah.
one partner has ADHD, one partner doesn't, and it can help you understand a lot about them.
Absolutely. Yeah, we'll definitely plug that one in. The next part that we have here, I think, ties in where it looks at the types of ADHD. So
Oh, for
you've
sure.
got hyperactive and impulsive type. I'll break that down a little bit. You've got inattentive type,
Mm-hmm.
and then you've got combination type. So I'll break down the hyperactive, impulsive, and then I'll give you the next two. Common
Sure.
symptoms there. And again, this is ADHD. And what's really highlighted is the hyperactivity, the impulsivity. So that could be that you have a
Mm-hmm.
hard time waiting, maybe in line, waiting for your turn. It could be that you blurt out things. It's hard to kind of wait and be patient and practice that 5 second rule. One, two, three, four, five. Now I can speak.
Mm-hmm.
And that goes with interrupting others or intruding in people's spaces, whether it's physically or verbally. Now, just for a little bit, we'll plug in a relationship, right? If you're in a relationship and this symptom is showing up, that could be that you're with your partner, you're at the movie theaters, and now it's a long line, and you have a hard time regulating your emotions because you've got to wait long, right? This is long line. You got to wait for a while. So now you
Mm-hmm.
become irritable and frustrated, and then that could lead to tension and just a bad date overall.
Mm-hmm.
And we're looking at, well, why? It's not a big deal. It's just waiting for a long line. Well, with the ADHD we talked about earlier, your executive functioning, right? If we have this area hindered, then there's just that difficulty. It's a little bit harder to do this.
Yeah, for sure. Which I love that you brought it up because you're absolutely right. It affects our lives in so many different ways. I'm going to grab that inattentive type from you and say that that can look like forgetting to complete daily activities. So, things like closing cabinets, brushing teeth, putting away clothes, um, having a short attention span, and having trouble focusing or concentrating, and poor listening skills or the inability to pay attention when you're being spoken to directly. That can cause all sorts of strains, like someone's talking to you and it is going in one ear and out the other ear,
Hmm.
literally. Not because you don't care, but literally because there's something happening and the brain is not capable of processing in that moment. Is that
Yeah.
to say that everyone with inattentive type ADHD is a bad listener? No, absolutely not. Depends on the stimuli. What if, we're in a coffee shop and we're talking and there's the noise of the espresso machines and other people talking and folk walking, music being played? There's too much sensory input. So the brain decides to say, okay, well, something has to go. I'm going to choose this conversation because I can't do everything all at once. And it's a lot harder to tune out other things.
Yeah. And just as a quick note, as we're going through this, this is not a I have ADHD, I can't wait in line. I have ADHD, I'm always going to blurt out things. I have ADHD, I'm never going to finish the project that I'm doing.
Mm-hmm.
It's not to say that. It's more of let's bring attention to why certain things are happening in life. And now that we have that awareness, we can start to implement different therapeutic exercises, techniques. JC and I are clinicians. There's clients that I work with that have ADHD, all the way from children to adults. JC, I'm sure you have many examples of individuals you supported with ADHD.
Sure do.
So
Very much
as
so. And it
Go
looks
ahead.
different for everyone.
Yeah.
And I'm so glad that you said, oh, I've got ADHD, I can't do that. That actually creates a negative stigma that people can't escape from. And when we use that sort of verbiage of the I can't, not only are you hindering yourself, you're doing a disservice because
Yeah.
you absolutely can do all of these things. You just need a little bit of additional support, which is why, being in therapy can be so helpful for those of us who are neurodiverse in that way. But there's still a lot of stigma around it, I find.
I agree with that. There's a lot of stigma, um, a lot of, get over it. You're just being lazy. You're not trying hard enough. And that, I've personally heard a lot of those words towards me. They don't feel good.
Mm-hmm.
They're hurtful, and they can increase. We don't have to go all the way into this. They can increase symptoms of other disorders, such as like depression. And just as a little side note, there's a lot of research that brings attention to ADHD, and then there's comorbidities with it, meaning that having ADHD, there's a strong likelihood that there's also some depression that could be with it, or some anxiety, or some conduct disorder, or at-risk behaviors. And the list goes
Mm-hmm.
on and on.
Absolutely. And I want to let you know that you activated my fight or flight because I
Mm,
cannot tell you how many times
yeah,
I've heard someone say, oh, well, you just need to get over it. I would love to. That's not how it works. Um, it's important for us as clinician and just for us as individuals to be able to be curious about other people's experiences, even if they're not our own. Because just because we experience ADHD doesn't mean that we know our clients' like definitive experience. It's going to be different for everyone.
correct.
And that curiosity ultimately leads to beneficial development for neurodiverse folk and the neurotypical people who support and love them.
That's a strong point. maybe that could be where we look at the personal challenges. I'm gonna borrow that one from you.
Mhm.
I'll give you the personal challenge that if you have somebody in your life with ADHD, approach them with curiosity, with kindness, compassion. Ask them questions. What's it like? How does it show up? What does it feel like physically? What does it feel like emotionally? How can I be here for you? But really put yourself in that position of just wanting to learn. And you're gonna find that giving someone that space, whether it's a friend, your child, a partner, it's going to take a lot of pressure off of them. And it makes it just that little bit easier for them to start feeling excited and eager and willing and supported to do the work, the next steps.
Mhm. That's such a good one. That's such a solid personal growth challenge.
I thank you for it because
Hey, listen,
I
but you're the
did
one who
just take
put it
all of it.
together. So hey, it
Teamwork.
was eloquent. Teamwork makes the dream work. For my personal growth challenge, I'm actually going to address the folk who are listening to this who may have ADHD. And I want you to take a little inventory of what it is that you need to be successful. What sort of accommodations do you require in order to be your best self? If it's additional alarms, if it's quiet study space, if it's a butt ton of fidgets on your desk so that you can focus, see what it is that you need and unashamedly acquire those things so that you can be your most authentic and well loved self.
Love that. It's a lot of like good, genuine love in it. Well, good episode. This
Part.
this episode on ADHD, I think, gave us a lot of good ideas for some future ones to put in there.
Absolutely. Absolutely. This was great. I appreciate the conversation. I appreciate you guys for tuning in and listening to us. And
Matt,
we're going to catch y'all on the flip, I guess.
we'll see you in the next episode.
See ya.